Ebola virus can cause a potentially fatal infection by severely damaging vital organs, including the liver and kidneys. Ebola was first discovered in the mid-1970s in Central Africa. Since that time, it's caused about 20 different outbreaks, all in Africa. Ebola has been in the news and on the minds of many people in the U.S. over the past several weeks, really for two reasons. First off, the current outbreak going on in West Africa has now already claimed more than 10 times the number of lives in the greatest outbreak of any previous Ebola. The second reason is that for the first time, the Ebola virus has now made it off of Africa, both into the United States and into Europe. It's important to keep in mind that the virus only gets transmitted through direct contact with body fluids and only from body fluids of someone who is actively ill from Ebola virus.
Well, clearly those most at risk are people who live in West Africa, particularly the three countries that are affected by it, which include Liberia, Sierra Leone, and Guinea. Other people at high risk are those who are in contact with those, particularly healthcare workers, are at probably the highest risk, both in West Africa and as we're seeing in this country, although the risk is much smaller, it would be healthcare workers that are actually at the most risk, not the general population. Certainly if somebody has been to an area that's epidemic, and right now in the world that's a very precise area, those three countries in West Africa, or if they've had contact with somebody in the last 3 weeks that's been from those areas, then they should seek medical attention promptly at the very first signs of any of the symptoms of being unwell, including fever.
Ebola presents like many viruses do. People oftentimes will begin to feel achy, they feel fatigued. In most cases, people develop fevers, although not in every case. And typically, nausea, vomiting, and diarrhea will develop. So about 3/4 of people who do develop Ebola infection have those three symptoms of fever, vomiting, and diarrhea.
At this point, healthcare workers need to follow the guidelines from the CDC, from the local health department, and that their facility has or is putting in place to protect themselves. This basically consists of personal protective equipment that is impermeable to infected bodily fluids. I think the other important thing to do is to make sure you get a flu shot this season so that you're protected against the flu, and it will also make the healthcare system, the doctors in the emergency rooms, a little bit better able to identify any potential Ebola patients if the population is protected against the flu and we're seeing less flu than usual.
Calvert Memorial Hospital has been working with the Calvert Health Department. We in turn work with the experts at the state level and at the CDC. The Calvert Health Department is in daily contact with both the state level and federal level infectious disease experts to make sure we're up on the latest protocols. The hospital has been doing a terrific job in also keeping up with those protocols and training workers in simulated scenarios so that if, in the unlikely event, but if we should end up with an Ebola patient, that everyone here is properly protected, can take good and proper care of the patient, and at the same time make sure they protect the workers.